way to connect different paths together.
100%.
You guys can both still do your. I know Jordan, I know you, but Andrew, you've still been able to practice in this time.
Not in stage 4, man. We got an email
Huh?
at the start of stage 4, pretty much outlining osteos and chiros or anybody who's affiliated with APRA can only see patients that are a medical emergency, so the equivalent of like a hospital grade emergency. So pretty much, yeah, unless you can only go to a hospital for your injury, you can't come to us. So we can't see routine back pain, neck pain, shoulder pain. We can't see patients who are just like in care with like rehab, like it's not permitted, which is bullshit. And apparently the breach of these rules, it's $100,000 fine for the business, and it's a $20,000 fine for the practitioner. So if the practitioner owns the business, it's a $120,000 fine for that person.
Yep, and that's heavy consequences, right? And that's. But Jordan, you as a physiotherapist have been. I know that. They haven't said anything to you guys?
Had been as in what? I lost the reception there, so I cut out a little bit.
Oh, good. I know you've been able to still do your physiotherapy sessions.
Still able to physiotherapy sessions, but cut back a lot. In I'm only seeing certain people now and not as often.
Got it.
Just because all the guidelines that have come in. It's super grey, which makes it very difficult to know what you can and can't do. But we've had to back off quite a lot to only do, I guess, important or more essential type services.
I see. So it's a category like of, you can only see a certain type of critical level of patient for like that they're at in their. Does that make sense?
Yeah, definitely.
Jordan, did you get a similar email to what I just said before?
I heard the end of what you said, and I think I got something pretty similar.
Yeah.
But again, it's hard to know exactly where to go from there, I feel, because the way that I guess think is going to be different to how you think. It's going to be different to how someone else thinks. It's going to be different to the next practitioner thinks. So I think it's still very subjective, but at the same time, we've got to be quite smart in who we are seeing, and the people that aren't going to deteriorate over these next 6 weeks will have to stay at home and just not do as much. The hardest thing I find with what I do, because I see a lot of ACLs, is trying to find out where I can go with that, because I know that for a lot of them I see I've had to cut out because they're not going to deteriorate, but those early to middle stages, not maybe strength-wise they're not going to deteriorate, but mentally they're going to start to challenge themselves. The pain levels are going to come back. They're not going to know exactly why this pain's happening or blah, blah, blah. So I think it's not only the rehab side, but it's the education side as well.
100%.
That needs to come in. And I guess that's where some telehealth and stuff like that can really play an enormous role as well.
Yeah, fair enough. Fair cool. I know quite a few practitioners are still doing telehealth stuff. I know a lot have shut shop until stage 3, kicks back in.
Yeah.
I actually know quite a few who are just ignoring everything, and they're still seeing 20 plus people a day.
Yeah.
Huh.
And I heard a rumor that one profession already is under investigation for breach of rules. So they could be up for the $100,000 fine. So I don't know, man. I mean, I don't know if they've got $100,000 to throw away like water, then go for it. But you know what I mean?
Well, Jordan, you brought up that's interesting. I didn't know the details, and I think that's important because my understanding was incorrect. And you guys don't have full, as allied health professionals, you don't have full access to your patients and clients. So you talked about ACLs and like the challenge of managing, not so much the physical but the mental. So I wonder, how do you both deal with that component where you're not seeing your patients as much and your clients as much, and you're having to adjust the physical and the mental? How do you adapt to that?
I think it's just really good communication. if you can have really good communication with your clients, if that's via telehealth, if that's via email, if that's via text or call, and just talk to them about exactly what's going on, pretty much empower them so they can do a lot of these things, it makes it a lot easier. But when there is no communication and they don't know exactly what's going on, that's when they kind of second guess themselves and they don't know if they're doing the right thing, if they're doing the wrong thing, what this little niggle is, what this pain behind the knee is, stuff like that. They start to really second guess themselves, and then they can go down a dark hole if that keeps going without any good communication.
100%, 100%. Yeah, that pain education is a very, very big component to what we do as allied health professionals. And 100%, man, like everything that you were saying, like they get one little niggle here and there and they think the worst. So
yeah, and it's
very
so
important to educate them on that stuff.
Yeah. And it's just us just saying a couple words like, yeah, that's fine. We see that quite a lot. Just keep doing what you're doing and leave it at that. You don't need to get too in depth or anything, but people just want that reassurance.
Yeah.
And again, all we do as allied health professionals really is empower people.
That's so important. The points you guys made. How are you managing your communication now? Like for me, like you would have seen, because we work pretty closely together. You see, some coaches might have things like check-ins, some coaches, like my coach, he has like a weekly call check-in, right? Where I'm on the phone with him every week. How do you guys manage that communication? Is it as simple as a text every week you'll send? Is it an email? Like, is it an app you use? What are you guys doing?
Well, with me, because I'm a strength coach as well,
yeah,
I still communicate with my clients through Instagram Messenger. But I don't know, when it comes to that sort of stuff, man, honestly, like online stuff, I'm a bit thingy about that. Like, especially now with lockdown, it's like most people are not going to have the equipment at home that they would at the gym. So it's like very hard to write a program that's the equivalent to what they will be doing in our sessions or at the gym. All right. So for me now, I'm just giving the advice and the education of just keep moving, just do what you can for now. Giving them a few tips and tricks here to how to maintain some sort of strength and endurance through this time. But in terms of writing specific programs and everything, it's just too hard because I haven't got the facilities around it. And in terms of my patients, well, it's a bit, that is also tricky because there's that, you can't really communicate with patients outside of your work hours. There's a bit of gray area there in terms of how much communication there should be. Sorry?
What do you mean you can't?
So there's confidentiality sort of barriers. So it's a bit, unless the patient is your friend.
Does the patient have to be like yourself? It can't be from another clinic. Is that what you mean?
It's just like, how can I explain this? So let's just say, for example, you're a business, right? Let's just say you own an office, for example, right? The working office hours are between 9 till 5, right? The person can contact you between those hours, but then everything after those hours, the person shouldn't be contacting you. That's the kind of gray area that's around that. So if my patients are contacting me after the hours that I see them, unless it's an absolute medical emergency, then okay, I can reply or I can talk to them. But we've been taught through our studies and everything that we cannot be communicating with our patients outside of the consult, because it's like, for example, what if they message you and say, oh, I've got back pain, what shall I do?
Yeah.
And then you say, okay, well, do this and see how you go. And then you make it worse over the phone. They could potentially sue you because of that. But it wasn't an actual consult. You know what I mean?
So it has to be under the banner of a consult where there's money being exchanged and it's within a business.
Yeah, 100%. Whereas if they've come in to see you and you guys go through the proper consult and the proper procedures, if you make it worse, well, you've just you've just given the advice and the treatment based on your knowledge of the presenting case.
Okay. Is that same for you, Jorden, as a physio? I mean, you guys are both coaches, actually, which is great because you guys come from an umbrella. Sorry to interrupt, but I think the point I'm trying to make is that I think you guys could probably attack those other areas that are more limited in the allied health professional with the strength coach approach.
Definitely. Well, the way, if we talk about kind of that communication side again, the way that I do it quite differently with my normal, let's say, physio clients that I see at my physio clinic that I work at, exact same as what Andrew says. When they're in the consultation with myself, we do what we need to do. After that, there's not too much communication. And if it is, it's normally through my practice manager or something like that. However, on the other side, in the strength and conditioning gym, there's a little bit more after hours that if someone needs me, I will communicate with them, especially because 99% of these people are ACLs. So I like to stay in a lot of contact with this side because they're always going to have questions. They're always going to ask something. So it's not saying too much in that time when you're not with them, but just give them little heads up of stuff that they need to do, need to stay on top of, and just have that constant communication. And then when I'm with them in the clinic or in the gym, that's where we have those big conversations and stuff starts to get rolling, and pretty much go from there. So it's kind of, I do a little bit different to what I do on my physio side to what I do on the strength coach side.
Okay. 100%, Jorden. I'm exactly the same as you. And then there's that bit of grey area where it's like, okay, well, what if your strength and conditioning client is also your physio or osteo client? And then it's like, well, if you're talking to them, if they're talking to you after hours as a strength and conditioning client, oh, hey, man, do you think I should be doing this on my recovery days? Then you say, yeah, do this, do that, blah, blah, blah. But then all of a sudden they've got a physio-related question for you. Yeah. And you're like, well, I mean, how can I kind of answer that and tie it in with that other question? You know what I mean?
Yeah, and 100%. And that's where that communication of, hey, we'll talk about that next session. But in the meantime, keep doing this, keep doing that, and just stay on top of what you got.
Yeah. It's very, Alex, it's very thingy, very grey area. You got to be very careful sometimes, man. You know what I mean? I mean, there's always ways around things, but Jesus, the rules are ridiculous sometimes.
Yeah. I mean, you can see why they're there. You know, yes, it's under the guise of like, yes, we don't want to malpractice outside of hours. We want to do it professionally. Yes. But you can see maybe the legislation is also set up in a way to maximize profit and business and do it all under the banners of like, make sure there's always money being exchanged. Maybe that's not always the best effective way to get results for the human being and client. I mean, you guys may push back and challenge against that. I don't know.
Okay, well, 100%. But think of this, right? So you're both PTs and coaches, right? Think of it this way. So, and again, I don't want this to sound like I'm money hungry or anything like that, which I'm not. But think of it this way, right? Let's say a client messages you and you give them the best piece of advice ever that could achieve all their goals through one text message. Now, that person could have been potentially paying you for 10 weeks straight, and you can watch them progress and you can teach them properly. Or that one little piece of advice you've given them, all of a sudden, you've lost 10 weeks worth of income. So, you know what I mean? There's two ways to look at that. You know?
Yeah.
It's very hard because at the end of the day, it is a business. And myself, I don't think of anything I do right now as a business at all. I just do my thing. I really enjoy coaching. I really enjoy being a physio, but I don't think about the business side at all. For example, I spend an hour with all my clients and only see a couple people a day, let's say 6 to 8 people max a day. Whereas if I was super business related, I'd be seeing 20, 30, 40 people a day to really make the money. You still got to make money, but I believe that if I can see that person for an hour and only see them once a fortnight at the moment or once every 3 weeks, they're still going to get good care when they're with me. And then the rest of the side, I can put it online where I'm not really making any money, but they're still progressing.
Yeah, 100%. And that'll come back to you later on in terms of, hey, this person's fantastic. He doesn't spend just 20 minutes with you. He spends 45 minutes to an hour with you. He goes through assessment, case history, does his hands-on, whatever, and he prescribes exercise rehab. as well as giving you pain education and pain advice to reduce the rate of pain that you may be experiencing throughout the week. There's a big difference between that sort of stuff. And I know so many clinics, man, 15, 20-minute appointments, in and out, crack, see you later, who's next?
Yeah.
Hey, they're making a killing.
Yeah.
They can afford to buy the Mercs and the Beamers, but at the end of the day, it's like, well, are you getting the proper results from these people? Or?
Yeah, 100%. I'm with you there.
And that's a big disconnect. But you can see that. Like, we can see that so clearly now. Like, those types of practices, I think, are getting weeded out more and more. But, we talked about, you guys as strength coaches and as allied health professionals, how do you guys, and I've seen you, Jorden, do it. Andrew, I haven't obviously been as familiar with you, but how do you both bridge that gap between the strength and conditioning world and the physio world? Because one is more early stage, more diagnostics, and one is like, great, preventative. We don't want this to happen again or as worse. How do you guys marry the two?
Question, are we recording?
Yeah, of course. We live.
Are we?
Yeah.
Oh, I didn't even know we were recording.
Sometimes I don't even say, because I just want to talk.
Yeah, I'm just like, okay, well, it's quarter past. I didn't even know we started recording.
Yes, sir.
How do I bridge the gap? All right. Well, the first thing is, so obviously all the knowledge that I have through my previous studies, I try to implement it as much as I can. So when it comes to the coaching side, I talk, when it comes to the coaching side, it's more about movement-based exercise prescription. So how can I teach this person to move correctly so the risk of injury reduces significantly, so they don't have to potentially go down the path of, I need to go see an osteo, chiro, physio 2 to 3 times a week. That's how I kind of bridge that gap, educating the person. This is how we're moving. This is why we're moving like this. And this is how you can improve by doing these exercises in this formation, if that makes sense. Mm-hmm. That's how I kind of bridge that gap. But when it comes to the osteo side of things, well, it's a bit different, especially like in a clinic where I haven't got the setup of a gym. I kind of try to get an idea of how the person's moving just by what they're telling me. I might get them just to show me a couple of things, but try to get as much information from the case history and from the assessment as I can. But pretty much it's just using my anatomical knowledge and my background in terms of, okay, well, which muscles are weaker, which areas are more restricted, what can I do for this person to get them moving better and to strengthen certain areas in order to reduce the risk of injury and for this to occur later on down the track. Does that kind of answer your question?
Yeah, Alex? Definitely.
Yeah.
I mean, you can clearly see how you look at both and put them together. What about you, Jorden?
100%. But that's the thing, like you can't...
Oh, go ahead.
That's the thing. A big part of what we do, and I know Jorden can back me up with this, a big part of a patient's management strategy is through resistance training and exercise prescription. Like, yeah, even though we know hands-on manual therapy, it does work for a lot of people. But in terms of long-term results, you need to implement some sort of exercise-based program for the person to reduce any risk of injury long-term.
Yeah, definitely. I guess the way I go about it is, very similar. Andrew and I, it's quite easy for us because we're allied health professionals and we do strength work. So that connection there is super easy, going from day one of injury all the way to return to sport or return to goals. But for a lot of people that only have either an allied health profession or just a strength coach or a PT, that disconnect is huge. And I think it's down to, I guess, trust sometimes. It's down to maybe greed sometimes, or just lack of communication that we've got to bring them together and really integrate. And I guess at Woodford's, it's quite easy for us because I work with all the strength coaches. So that communication is constant. I can get you to come into the room when I am treating one of your clients, and you'll know exactly what's going on from day one, rather than me trying to send you an email or trying to give you a call and I can't get onto you, or the client doesn't remember what I said, stuff like that. I think that's super common, and that's why this middle section here needs to reduce, and that integration model needs to happen a lot better. But I think it's just, if you're an allied health professional, have a good strength coach around you. If you're a strength coach, have a good allied health professional around you. Close
100%.
that gap a lot, and everything just works. It just works so easy, and everyone just knows what's going on. The athlete, the coach, the strength coach, the allied health professional, everyone's in the exact same bubble, and we can start to move forward. Whereas most of the time, it's the physio is here, the strength coach is here, athletes kind of in that middle area, and we're just trying to figure out what everyone says. You know what I mean?
100%. But you know what, man, I've noticed there's even a gap. So I did exercise science before I did my osteo degree. And I even noticed, even though the exercise science degree was a very theoretical based degree, when I went to work with some strength and conditioning coaches, their knowledge of movement was so much superior than mine. My knowledge around physiology and biomechanics on the theoretical perspective was pretty good, but their practical application and how they would explain things was just second to none. So even going from an exercise science degree or exercise scientist, then talking to a strength and conditioning coach, there's a gap. There's even a gap there. And it's funny, actually, a friend of mine, actually a colleague of mine now, the gym I work at, the owner, so a friend of his was doing an exercise science degree. Same thing. This guy knew everything about everything, physiology, whatever. But then when it came to movement-based application, he had no idea. So my friend, who's a strength and conditioning coach, he had to literally teach him, this is why we deadlift like this. This is why we squat like this. This is why our limbs have to be in position like this. And he knew none of that. But he could tell you everything about ATP, PP system, anaerobic glycolysis, Krebs cycle. He could tell you everything about that. But when it came to movement-based therapy, he was just, the knowledge wasn't quite where it should have been.
100%.
So what's your answer to that, Andrew? You know, for the allied health professionals and coaches listening, how do you think we can integrate each other better?
You know, it's funny. On Instagram, I'm in this group chat with a bunch of strength and conditioning coaches all around Australia, and we talk about it all the time. I think, and look, this goes for every degree. I think there are a lot of wasted units in certain degrees. Like, for example, you'll have, in a semester of uni, you'll have 4 subjects, right? 2 of those will be fantastic. You will learn all these things. 2 of those will just be absolute shit and waste of time, right? I feel like when it comes to the exercise science base of things, I don't know what it's like now, but I know when I did it, a lot of it was theory, and the theory was fantastic. I learned a shitload of stuff. But in terms of the practical application, how to move correctly, how to work. I mean, being in the lab, and Alex, I've had a very good chat with your friend Alex and colleague Alex Gamruzes about this. We had a great chat about this. You spend more time in a lab coat than you do in a gym, right? Yeah, so you spend more time taking blood lactate levels, VO2 max, all that stuff, and not enough time. Okay, guys, this is how you deadlift. This is a hip hinge. Why do we hip hinge like this? What are the determinants of recognizing an effective hip hinge? What's the difference between a sumo deadlift and a conventional deadlift? How does a trap bar deadlift differ to all these other deadlifts? You don't learn any of that stuff. You know what I mean? And I think that area is lacking in terms of an exercise science degree, because those are the fundamental movements in a gym. How many people do you know who go to a gym who want to learn how to deadlift? But even then, you think about everything you do during the day, you're picking something up off the ground. What's that movement? It's a hip hinge. It's a deadlift. Yeah. You're in the garden or whatever, you're doing something, you go to squat. That's a squat. You know what I mean? 100%. Like you don't learn that. Yeah. You learn, let's put a big mask on your face with a tube that's going, you don't know where it's going, and let's measure someone's VO2 max levels and their blood lactate levels. Even though that's fantastic, but how can you apply that unless you are working with an elite level sporting club?
Yeah. It's very clear why that is the case. We know it's like exercise science degrees, they're sold in the culture to prepare you to be a coach. But it's kind of one of the biggest lies about it, because it's not designed to prepare you to be a coach or trainer. It's designed to make you an exercise scientist and prepare you for further study so you can be potentially a lecturer, or even more so, a researcher, because that's where a lot of it leans, and that's where a lot of money is in research, at least from the university setting. So it makes sense why, right? But it's still a problem. And I think some universities are trying to do a better job with like strength and conditioning majors. They're recognizing even this term of strength and conditioning, which is great. But I think if you want to be a coach and trainer, exercise science degrees is just a foundation of theoretical knowledge. It's like just a couple of pillars. Like you need to like liaise in other areas to build that well-rounded skill set of a practical skill set.
100%. And I feel like if they implemented a little bit more of that in the degree,
yeah,
then the degree overall might be a little bit more effective, I think.
Absolutely. But then again, it's like, well, I think you think about degrees, and you guys remember when they'd ask you at the start of class, "I'll put your hand up if you're from this area, if you're a nursing, or if you're a biochemist, or if you're this or that." It's like, oh, you guys aren't catering for nurses and coaches, and you're catering for like everybody under this umbrella. Like, oh, of course it's broad. Of course it's not specific. That's later on, because we can't do specific now. We have to be efficient, and efficient is putting everybody in this bucket of a health professional and trying to teach them effectively. So, I'm mad at it, but I'm not mad at it. Does that make sense?
Yeah.
I understand.
Very true.
We got a question from Matt Whiprick. Okay. Both you guys talked about education around the client and around injuries and management is key. But what key principles or specific learning points are really important to teach new personal trainers? Just to help give PTs context in working with clients who experience pain and injuries.
That's a good question. And it's definitely a hard one to answer for let's say PTs, because injuries, pain, discomfort can be quite complex. And it does take time to understand exactly what's going on with pain, what's going on with certain discomforts, how do we need to progress forward from this. But I guess getting them to understand even the basics about certain injuries, understanding the basics of pain and how complex pain is, can be a very good starting point for a lot of PTs, a lot of early strength coaches, to understand what is okay in the gym if there is a little bit of discomfort or pain, and what needs to be maybe referred to someone that knows a little bit more as an allied health professional to maybe diagnose or find out exactly what's going on. And I feel that gets lost a lot, because we see a lot of people that even come into allied health professionals sometimes with just DOMs, that they're just sore from starting training.
And they just haven't felt that before?
But haven't been educated what DOMs are, pretty much, and what's going to happen with these little niggles and pains and discomforts, where they don't really need to see us. They can stay with their PT or their strength coach and just keep working through it. But then that disconnect happens from the start right there. So I think good education on the basics, and then progressing from there if they want to learn more, I guess.
Do you have a resource? Because as you know, like Orphic, we coach and we train personal trainers, from students to the personal trainer, to certify them. How do we get there? Like, what do you tell those guys from the injury management perspective? And I'm kind of branching off this question, so please, Andrew, I'd love to hear you about the first question. But Jorden, is there a resource you have, or like a couple of education pillars you'd recommend?
I don't know if there's a resource as such. It's just, I don't 100% know if there is a resource that I've used. It's just over the years of learning more stuff about injuries, about pain levels, about pain science, that I've just picked this stuff up. I think it's quite tough, and Andrew might be able to answer this better, but it's quite tough early on to get people to understand about certain injuries. to get them to understand about pains and discomforts. So it's more about just a whole going through professions like osteo or physio that we learn a lot about that stuff. And I think that's what puts us apart a little bit. And where you do need someone you do need to have a referral to a good allied health professional where you can learn a lot more about this. Even if it's having a mentor that's a physio or a mentor that's an osteo, where you can start to pick up a lot of this information and you can use it in your practice. Maybe you could explain that better.
That's what you did, though. We talked about it on my podcast. We talked about how you got those mentors when you were younger, and that taught you a lot before you did your degree. 100%.
But I mean, for let's say for a PT or a strength coach, having a physio mentor, having an osteo mentor that can just give them those little things. Like I've got a strength coach mentor that helps me keep progressing through with that side of it.
So my response to the first part, 100% agree with what Jorden just said. Everything about pain education, how it's okay to be sore from training. That's fine. I had a patient recently. Actually, it was very interesting. I should say recently, probably about 6 months ago. Big powerlifter, lifts a lot of weight. And he was questioning to why he's always sore after he lifts a lot of weight. And when I say a lot of weight, I mean rack pulls 180 for 5 sets. All right. And again, it's that re-education of this is a result from exercise. This is what happens to our tissues. It's all a part of adaptation. So like Jorden just said, all education about pain, and it's okay to be sore, it's fine. And trying to teach them that there's different types of pain. So they may be experiencing different levels of pain, different types of pain. And it's okay to be sore, because actually recently I did a podcast with a naturopath and I was talking about pain and inflammation. Pain is not actually a bad thing. Pain is just, it's a protective mechanism. So if you've got knee pain, for example, it's like, okay, well, that's your body telling you, hey man, there's something going on here. Let's kind of have a look at what's going on here. So it's not a bad thing. Pain doesn't mean tissue damage. Excessive amounts of pain to the point where it's almost debilitating, okay, there could be some tissue damage there. But educating the patient on DOMS versus debilitating pain, that's a big factor. And tying that in with how to help PTs kind of understand that, like Jorden just said, having someone else who you can kind of learn off and mentor off. Like Jorden, you said you've got a strength coach who's a mentor to you. Is that right?
Yep.
Yeah. So having that, and even vice versa to that. So with my background, my colleague now, Daniel, who owns the gym I work at. So I learned a lot of my strength-based knowledge of him in terms of movement, all the fundamentals. I learned it off him. Whereas my theoretical side of the body, both exercise and injury rehabilitation, he learned off me. So I think that kind of scenario that Jorden was talking about, it's the perfect scenario. You can't get any better than that, because you're always going to be learning off each other. And I can almost guarantee you that person is going to find out about external resources where they can learn. So like webinars, seminars, and they can say, hey, this person's doing a webinar on powerlifting. Do you want to come to that? Or vice versa. Hey, this person's doing a webinar or seminar on injury rehab and exercise prescription. You want to come to that? Whereas if you didn't have that, your learning may be limited to a degree.
So you guys talked about, I'm trying to passing out the information here. So definitely pain science is definitely a key thing, and the difference between like how much pain, discomfort, soreness, like defining those for the client and getting them to contextualize those. What are some other principles that you guys think the early personal trainers need to know around rehabilitation and injury management?
Rest is not rehab.
Oh, absolutely. Tell him, Andrew. Oh my goodness.
Look. I still think rest is important. He starts moving. Rest is still important, and there's a lot of evidence to suggest that, like muscle tendons, especially because there's two different types of tendon injuries. There's tendonitis and tendinosis, right? So tendinosis there's a factor in there to show that rest is actually important for a tendon in that component. So rest is still important. However, injury prevention requires appropriate external load for pain management and injury rehabilitation. That's an important factor. Rest is not rehab. Exercise is rehab.
100%. And I guess a lot of them need to understand as well that, and this is probably a lot of allied health professionals as well need to understand that it takes time. Rehab takes time, and you're not going to see changes in 1 session, 2 sessions, 3 sessions. They need to understand that you've got to do the basics right, do the basics for a while. That might start with some more isolated exercise and progress into a normal training period or training block, but it does take time. Any injury, any discomfort, any pain is not going to go away like that. Sometimes it does, and we're like, we're doing this perfect. But other times it does take a lot of time. But just going through the basics, keep reassuring, keep empowering people, and you'll slowly get to where you need to be.
How do you get people buy-in that sense in a world where people want shit like this? And it's like quick fix, quick pill. How do you get buy-in that patience, long-term, more money, more effort? How do you get them to get into that process?
Good communication. Tell them what the end goal is from the start. If you're going through a period where you're like, it might be maybe 3-4 weeks and then you'll be good. And then they get to 3-4 weeks and they're like, I'm feeling the same as I was 3-4 weeks ago, then you've already lost them. But if you've got that good communication from the start as to say, this is what we've got to work on, this is what we've got to hit, and this is kind of a rough time frame that we might be able to get there in. But if you just keep hitting this and slowly working up the steps, slowly getting up that mountain, you're going to get to where you need to be. So communication from day one, especially because as I said before, I work with mostly ACLs. That communication from day one is super important, because if it's not there, then they're going to get to all these different time frames and they're like, I don't know what I'm doing. I don't trust this person, and I'm going to go find someone else, pretty much.
That is so important. I think that's a mistake early on I made in my coaching careers, that I didn't give, we don't give clear guidelines and stepping stones, right? Stepping stones towards the end goal. And you give them these little micro goals, you give them wins. Every week they can celebrate a win and feel better about their progress. I think that's so important, what you just said, Jordan.
100%. Also, I'm going to add to that as well. So part of that communication aspect is putting the question back on them. So like let's just say, for example, if they've got an injury and they want to get back to playing footy, right? You want to ask them, how bad do you want to get back to playing footy? If your determination is 100%, then that means you should be putting 100% effort in to the rehab plan that I'm outlining for you in order for you to get back playing footy, right? If someone wants to get better, but they're half-hearted about it, but they don't want to put in the work during the week, well, then you need to explain to them, well, if you're going to put in half the effort, then you got to expect this pain to prolong for an extended period. I mean, like, for example, if someone comes in because they got back pain from their desk job and you prescribe them some exercises, some of them don't even want to do it. Some of them just want to come back and just get treated every week. But if you want to do that, that's fine. But you can't expect this pain to magically go away.
Yeah.
You know what I mean? The work you put in outside the consult is what makes you better. Because if you think about it, we only see the person maximum 1 hour, potentially a week or a fortnight. It's not 1 hour a day.
How do you guys manage maximizing adherence, especially in a profession where you can't legally communicate as much outside of hours? Like for me, I got my check-ins. You guys as coaches might have check-ins. How do you guys manage the accountability side to maximize adherence?
I guess it'll just come back to, if they really want an additional consult, it'll just be through an additional consult, either via telehealth or face-to-face. I mean, because there's so many rules around it, it's very hard to work around it. You know what I mean? Okay. But again, like Jordan just said, it's that communication from the start. It's really explaining to them, if you want to get back to this, if you want to do something at this level, this is what you have to do. And if you don't do it, hey, I'm not your dad. You can do whatever you want. But you got to understand that this is the result you're going to get.
100%. Yeah, exactly what Andrew said. It's quite different for me in the working in the physio clinic compared to the strength and conditioning side, because the strength and conditioning side, they've got so much to gain about getting back to sport. They want to be there so fast with the ACLs. They want to be there straight away. Whereas on this side, where I've got people coming in with lower back pain from sitting at a desk or neck pain or whatever, they don't have as much of they want to get better, but there's no rush for them to get better because they don't care as much, or it's not the biggest factor in their life. Whereas someone with an ACL, they want to get back, they want to go. So this side's so easy. This side is just that really good education from the start, and telling them if you do it out, just exactly what Andrew said, if you do a lot more outside of this consultation, you're going to get better quick. If you're just coming to see me once a week and we're doing some treatment, it's going to take some time, and you are going to get better, but it's going to take some time. And just getting them to understand that is the most important thing, because if they want it to take time, that's up to them. If they want to get better straight away, that's also up to them. They just got to put the work in.
Well said. So you're managing expectations from the start. That's what I'm hearing.
100%. Yeah, put it all out straight away, because then everything's going to be out there and they know exactly what they need to do. If you kind of hide stuff from them and you say a little bit week to week, they're going to start to, I guess, second guess and maybe end up going for, let's say someone goes and gets a scan, which most of the time that's the one thing I don't want them to do, because then it's going to even slow them down even more, because they're going to start thinking about this scan. But if I tell them what to do from day one, this is what you got to do. I'm going to 100% get you better. Let's just slowly work. It's going to work.
Very good. Very systemized, progressive. And like you keep hearing the constants, like constant communication and expectation management. How do you guys... I want to talk about communication because it's so relevant. I think that's what the art of coaching and the art of being a health professional is. We know the importance of it, but in the practical sense, how do you guys manage your communication styles from person to person to person? How do you stay adaptable? How has that changed over the years, the way you communicate?
Yeah, that's a good question, actually, Alex. It's not very different, but it's different in a strength and conditioning setting than it is with an osteo setting. When people are coming to see you as a strength and conditioning client, most of the time their goal is to lose weight or to get stronger, whatever. Your communication style will be the same, but a little bit different. Whereas when it comes to osteo or chiro or something like that, your communication style, it'll be a little bit more empathetic. You'll be using knowledge. You'll be using communication in the sense where you're trying to integrate. So there's this model that we use. It's called the biopsychosocial model. We use different aspects of their life to try and determine why they are in pain, where that might be biological, where it might be psychological, where it might be social, which ergo the biopsychosocial model, right? Whereas when it comes to strength and conditioning, yes, the empathy is still there, but the way you approach it is a little bit different because it's a different setting. It's kind of hard to explain, but I think the biggest difference in those two settings is that biopsychosocial model in terms of pain and exercise. Would you agree with that, Jorden?
100%. Yeah, 100%. I guess the way you communicate, it's going to be just pretty much what Andrew said. It's going to be slightly different for every client. It's going to be different in the strength and conditioning setting compared to what it is in the clinic. And it's just getting on their side early and getting them to trust you. If I walk in and maybe talk to how I'll talk to a 15-year-old, to a 60-year-old, it's going to be, they're not going to want to be around me because they don't trust me. They don't think I'm professional, stuff like that. Compared to a 15-year-old, you can have a bit of a chat with, you can talk about the footy, you can talk about the basketball, you can go down that side of it, and they're going to really buy in and get to understand you and know what you like to do. Whereas I guess you've just got to be quite smart with that, because at the end of the day, if they trust you, they're gonna get better. Yeah. They're gonna get better. Where there's those clients that don't trust you, second guess you, they're the ones that are going to move on, go to someone else because they don't feel like they're going to start to improve.
100%. And there's also like your communication will also change. This is more, this is both fields again, but probably more so in the clinic. When we look at patients, we look at what we call like orange and yellow flags. So if someone's got a lot of yellow flags in terms of like how they perceive their injury. So like if their injury, like based on assessment, if we only think it's like a 2 out of 10, but they think it's like a 7 or an 8 out of 10 and they really exaggerate it, well, your communication style with that person will be a lot different because their way of perceiving information is going to be a lot more heightened as opposed to someone who will come in and just be like, oh yeah, it's not bad, a bit of pain here and there, as opposed to someone like, oh, this pain is excruciating, it's a 9 out of 10, I can't move. But when you look at them, it's not that bad, like they're moving fine. So that's where your communication style, like Jorden said, you will talk to those people differently than you would to the more chilled out.
Let's go deeper. How would you communicate? Because one end might be like, they might be the tough guy or girl who doesn't want to admit that they're in pain. And the other end, it's like, oh, the over-dramatized character type, right? How do you guys then, let's go deeper, how do you communicate to them to not offend and to also respect that people feel what they feel, and perception is reality. So how do you guys go deeper on that?
It's just that reassurance. It's constant reassurance that, and education on the topic. So looking at, see, with those sort of people, you're going to be doing a lot more biopsychosocial stuff. So you're going to be communicating with them a lot more than you're actually going to be putting your hands on them, even though the hands-on aspect will be or could be a potential benefit to their consult. But for them, it's the communication and it's how you explain to them, this is what's happening, this is why it's happening, and it's going to be okay because usually with this sort of pain, this is how long it takes, and if you do this, this will be the result. So it's more education, empathy, like I was talking about before, and the constant reassurance that's going to be okay. Those will be a lot more exaggerated in the consult with those sort of people than the more laid back person.
Yeah, spot on that. It's that reassurance early on and understanding how important the things we say is to our clients. So what we say is probably going to be the most beneficial thing with those clients that are 9 out of 10 pain early on, getting them to understand that they're going to be all right. We're going to get through this. We see this quite a lot, and we're going to get back to wherever you need to be. Whereas on the other side, with that guy that just comes in, he's got a shit back or whatever, and he's just like, oh yeah, I'm just going through it. I've got to go to work. They're the ones that you've got to, you can have a little bit more fun with, but you've got to also sometimes even hold them back.
Yeah,
they're going to be that person that even, again, I keep going back to ACLs, but you got some of those ACL guys that are like, yeah, this is fine. I'm going through it. I'm just going to start running. I'm going to start doing this. I'm going to start changing directions. And they're the ones that you've got to hold back slightly compared to that other side that are so scared to move that you've got to slowly push, educate them, reassure them, and progress through there.
Yeah. 100%.
That's great. I think that gives two very good approaches into how you, and you know what, it's great. I hear it again, like reassurance. Like that seems so important to what you guys do, to what health professionals do. Do you guys say that now is because you used to be the health professional who didn't understand how to do that, or you've seen things like that have gone wrong? Like, how did you guys learn that was such an important thing?
I think just dealing with people for such a long time, it kind of just develops in you. Like I've been a PT for almost 8 years now, right? So I've worked with many different people. I was a boxing coach for a few years. I've worked with people in their 40s and 50s who just want to exercise because their doctors told them if you don't train, you're going to die of a heart attack. You know, I've worked with people who want to get strong and power lifters. But it's funny because during my degree, the biopsychosocial stuff, they were really implementing that all the time. And being in practice now, I can see it. I can understand it. I can see how the different communication styles change throughout so many people. And like Jorden said, how you word things to these people can play such a big role in A, if they come back and see you, or B, how they're going to respond to your treatment methods. Very, very big. You know what I mean? I mean, there's evidence now that if the person doesn't like you as a practitioner, if they don't trust your judgment, doesn't matter what you do, they won't get better. So, Alex, you could hate me as a practitioner, right? And I could treat your back, your lower back. I could do the same thing to you as I would to Jorden. But if Jorden likes me, Jordan's response will be 10 times better than yours. And if anything, yours will be the same.
That's such an interesting phenomenon.
Hmm.
How do you guys develop trust? Oh, maybe what do you do with the clients who aren't trusting you as much? Because everybody's been there. You know, is it a case of where you have to realize maybe the client coach isn't a good fit, refer you out to a different person? How do you guys manage that?
I just think it's trying to get onto their level early, because most people you can get on their side. Some take a lot longer than others, but I guess that's the most important thing about being a coach or being an allied health professional, is being able to adapt to every individual. So it's finding ways where you're trying everything to really get that client, that athlete on your side, because as soon as you break that barrier down, you guys are going to be working really well together. It may get to a point where, all right, this is probably not the best fit, and refer to maybe a different coach, maybe a different allied health professional, because you've tried everything and you still want to be in communication with that person. So you're referring to someone that you trust and respect. But most times, if you put the work in, you're able to break that barrier down, get on a pretty good, I guess, trust, respect type level with that client, where you can start moving forward. But it's just, keep going, keep trying.
Yep. Jorden hit the nail on the head there. It's that building the relationship with the person and the trust with the person. And you'll find as the weeks progress, they may even, if the more they trust you, they'll start to open up to you about a lot of other things. And then that's when you know, okay, this person trusts my skills. They obviously trust me as a practitioner, as a person. Like, they will potentially get the best out of me if I keep doing what I'm doing.
All right. I think there's a lot in there for a lot of coaches and health professionals there. It's great.
Same thing goes with the coach. If the person doesn't trust your skills and your knowledge and your programming, it's going to be very hard for them to do the program and excel in the program.
And do you think that at the end of the day comes down to just results? Just if they, and being a good person, a kind person, of course, having great character, but with that, just getting results 1 week at a time, 2 weeks at a time, one stepping stone at a time, that is the key to the trust building, or something else?
Yes and no. But again, the results will come down. Again, same thing as a coach, man. You see your client once, potentially twice a week with coaching, right? 2 hours a week. Now, their results, we know, will come from your ability to program, what they're eating, which is a big thing, and what they're doing outside of the session. So if they're getting results, not only do they trust you as a coach, but they're motivated enough
to keep going,
to make the change. That's the difference. Whereas you can get someone who trusts your judgment, they can trust you till the cows come home, but they're not motivated enough to do things outside, even though you're telling them to do it, which then the result can vary.
Jorden, what do you think?
Yeah, and probably the other thing to add there is when you are coaching someone, you've got way more time with rest periods where you're just chatting, where you're getting to know the person than you actually are lifting. So if you're not having that rapport where you're having good conversations, you're getting to know each other, you're getting to know what that client likes and what they don't like, doesn't matter how good your program is, they're going to feel awkward the whole time and probably not come back after a while. So it's understanding those rest periods are probably more important than the actual lifts, especially early on.
Amazing point.
100%. Spot on.
Because you can have the perfect program, like you said. You can have that, and I think that's a big lesson. I think for coaches, I know the students I'm teaching, like I'm telling them, yeah, we got to be efficient with our sessions. Yes, you got to communicate with your clients in between your rest periods, but let's use every minute efficiently. Give fillers, give this, give that. But even that can go too far sometimes. You'd be like, hold on, I need to see how you are. I need to actually connect with you on a human-to-human level and build that rapport and trust and connection, because it's a personal relationship you develop. So I just want to highlight that point.
100%. But then sometimes, there's that other side too, when even during the rest periods, and I'm sure you both have experienced this, when the client doesn't want to speak, or it's hard, you try to start a conversation and they just don't want it. They just shut it down. And it's like, okay, well, all right, second set, let's go.
What do you do then? How do you manage that? Whether that's maybe they're having a bad day, maybe they're more introverted. Like, how do you manage that?
It's me personally. I just try to, instead of asking them like about their personal day or whatever, I'm saying, have you, just general chit chat. Have you been watching any new TV shows lately, or have you had this? I went to this restaurant the other week. Have you been there before? Like, I try to steer it away from more their personal, like their like work related, whatever, and try to more like general chit chat. You know what I mean? Sometimes it's worked. Sometimes it's really like I've really had to like scrape the bottom of the barrel in terms of things I could talk about. But yeah, I mean, you just it's one of the things you make it work. You make it work if you got a personality, if you're outgoing, if you're a people person, you make it work.
Yeah,
so true. Yeah, I guess that's quite hard, because it might even get to the point where maybe the first couple sessions you don't have too much communication. You just talk about a couple key important things, and during your rest period, you're getting them to do more mobility work or getting to do different stuff where they're not really talking too much. You're just having that odd conversation where over the weeks and the weeks and the weeks, that conversation starts to turn into a little bit more. And then by a couple months in, you're starting to slowly have good conversations.
Because they trust you, they've opened up.
Very tough one though to get to that point, I reckon.
Yeah, people got to be comfortable, and that takes time for some people. Every human's different, obviously. Got a question from our man Jeremy Borzillo, who you may have seen, and it actually talks about some of the stuff we were talking earlier on with mentors that we touched on. Jeremy, and this is obviously for both of you, but interested to hear, who were your mentors coming up through uni and through physiotherapy and through osteo? Like, who were they for you, and what did they teach you?
I guess I was quite lucky. So when I was going through my exercise science degree, my partner's dad knew a pretty good physio on the Gold Coast where I lived. So I was hanging out with a physiotherapist named Tim Brown when I was still going through exercise science. And he was someone that even before I started my physio degree, he was talking about pain science and a lot about the pain side rather than just the hands-on and going through what we normally learn. So I already had that in the back of my mind before going into physio school. So I reckon that helped out a lot. And that's someone that I still talk to still here and there, because he was such a big influence in my early physiotherapy career.
I never really had a mentor. Like, I was quite self-motivated and self-driven to just learn on my own. I used to reach out and communicate with a lot of people, like going through my uni days. I used to do like OBS, we used to call it OBS, where you go to a clinic and you just observe a practitioner. So I used to message certain practitioners and I used to go observe them, see what they did, just learn off them. But and there was probably one or two there where I kind of caught up with a couple times outside. But in terms of a mentor, I don't think I could sit there and say, this guy was my mentor for an X amount of time. He was great. I'll kind of just my own mentor, if that makes sense. Like, I'm just very self-motivated to learn off different people and, try to apply that to my own style of whether it be strength and conditioning or osteo. You know what I mean?
Yeah, and that's a great thing because there's many ways to do this, right?
Oh yeah. Oh,
There's many ways for education pathways, and now in the 21st century, like you can literally get a world-class education right here. And guess what, guys? We're trying to do it every Wednesday. How amazing is that? All these amazing podcasts and pieces of education you can learn from all around the world, and that's what sounds like you've done, Andrew, or doing.
Yeah. Well, you know what? With the internet these days, there is no excuse to not learn of all different types of people. You've got journal articles you can read. You've got podcasts you can listen to, like you just said. You've got webinars you can watch. There's all different avenues. You know, even people at uni, all right, you go to uni, fair enough, that's fine. But what are you doing outside of uni? Are you studying what you're studying? Like, are you going over your stuff, which everyone should be? Or are you learning off other professionals? Like, for example, on Saturday, I'm doing a webinar. And I'd say the 15 people doing it, 10 of those people are students, which is fantastic because that just shows their motivation to learn and to better themselves as practitioners. You know, we need more of that. It's a big thing.
Absolutely. That's good. It's great to hear. Do you guys have favorite education resources, like favorite podcasts for health professionals and injury management, or just general health podcasts, books? What do you guys, something you're listening to or watching or reading right now that's you'd recommend?
So podcasts, I listen to the ATP podcast, the ATP project. They're fantastic. Love them. I also listen to occasionally, they're called Barbell Logic on YouTube. They're fantastic. I listen to Joe Rogan occasionally as well. Books. I probably the most recent book I probably got is this one here, which is also fantastic. I highly recommend people get that. They want to learn how to squat and learn about joints and how squatting is amazing for our cartilage. But I just try to revise many of my university notes as I can, as often as I can, to be honest with you, man.
It's good, man. You're using the big investment that you made. Why not?
Oh,
people just forget 100%. About it. They finish the degree and they're like, "Oh, okay, I'm done." It's like, what?
But how? I don't understand. You are a health professional, right? I don't know what your hippocampus in the brain is like. You can read one thing and you can just forget about it. I don't even know. I don't know a human being who's like that. You need to consistently be revising this stuff, man. Especially when it comes to like what we do.
Yeah.
The most consistent thing you're going to do in a practical setting, that's what you have to be revising. Very important.
Well said, Mr. Radliff. Radliff Rehab.
Radliff Rehab. A lot of strength and conditioning and track and field stuff is kind of where I'm going at the moment. So probably podcast, Pacey Performance podcast. I think he's from England, but he's just got so many, I guess, a broad spectrum of a lot of different individuals that have come on, from physios to strength coaches to high performance managers all over the world. So Pacey Performance podcast is super beneficial. And there's a lot that's like that, like even Altus, which is a track and field, I guess, company in Phoenix. They got a pretty good podcast, but they got even better resources on their online store. So Altus, ALTIS, is amazing for anything, I guess, track and field based, where a lot of it is going these days to a lot more involvement in sprinting and understanding technical side of that, compared to just the main lifts in the gym as well. So a lot of, I guess, strength coaches, physios, osteos are starting to think more about the track side, which is super important to a lot of rehabs. Other than that, books, just a lot of different strength and conditioning books, and then currently getting mentored by the big Jay Ellis, which has been really good as well. So this period's been quite good for me, I reckon, because I'm learning a lot. Because business has slowed down, it's giving more time for myself to go over different things again and stay on top of everything and progress my knowledge and listen to more podcasts, read more books, and go from there pretty much.
Absolutely. I mean, I think it's a good place to finish off. How are you guys using this time where you can practice a little bit, but not as much? It's up and down. How are you guys adapting during this period? What are you learning about yourself, about your business, about how you run? What's the standout over these last couple months that you're taking away?
Well, with me, because I'm not working until the 13th of September, or even prior to this. So currently,
I think what's so
planning
special
a
about
webinar, and I'm running it this weekend. Second thing is I'm learning how to play guitar.
That's cool.
Everything about it. I've played music my whole life. I try to play drums every day. All right. I train virtually every day. I try to read some of my notes every day if I can. And I try to listen to a podcast every day if I can. So I'm trying to tick all those things off every day, and all of a sudden 10 a.m. becomes 7 p.m. So it's like that's the day. So I'm just trying to use this time as wisely as I can, because I know if I was working flat out, I'll probably only be able to do 2 of those things as opposed to all of them.
Good for you. Good for both of you. I mean, it's like you either can be a victim, behave like a victim, or try and behave like a victor and use this situation to come out better. And it sounds like you guys are leading by example in doing that. Do you guys have any parting thoughts, questions or asks of our audience, or just where people can find you guys?
I guess probably the most important thing that we talked about today is that communication and how important that is, but also having that integration model. So if you are a strength coach or a PT, start to find an allied health professional that you can work with, that you can learn off, that you can be mentored from, and start that early. Because if you got that trust and respect, that integration model is going to work really well, and client results are going to improve from that as well.
Well, actually, to touch on that, how do you recommend actually coaches go about doing that? Because there's a million different physio, chiro, osteo clinics. Like, how would you recommend they find a good one?
I think the same way that we've all kind of done it is to just maybe from word of mouth, or just calling up a clinic, or just getting to know anyone is going to be better than knowing no one. So I think just doing some research yourself, even if that's on social media or just through the internet, through Google, just finding someone that's in your area, that you like their bio or something like that. You think that they're thinking similar things that you want to do, and just kind of progress from there. There's no perfect way. It's just trying everything, really.
For sure.
100%. I couldn't have said it any better myself.
Any last thoughts, Andrew, or just where people can find you guys?
Well, my Instagram account is takecontrol_osteo. My Facebook page is takecontrol_PERF. You can also look up my website if you like, takecontrolperformance.com. And in terms of just based on what we were talking about today, I agree with Jorden. Just how you communicate with your clients or patients is very important. That if you're in a practical setting in terms of a clinic, that reassurance and the education around pain is very important. Just understanding, there's so much evidence coming out about pain. It's ridiculous. And, trying to educate people on, listen, pain is not a bad thing. Okay. Pain does not equal tissue damage. And just because you're in pain doesn't mean you need to have a Nurofen like M&Ms.
Yeah.
Very, very important. If you are in pain, for whatever reason it is, all right, consult your practitioner, consult someone who knows about it. And then once they reassure you about it, do your best to try and take it on board and just forget about it. There's no point grieving over it. You know what I mean? Because that's a very, very limiting factor in terms of your recovery and performance.
Well, very well said. Is there a pain scientist expert resource you guys would recommend for people who want to dive deeper into that?
Well, there's a textbook called Pain. Can't remember who it's by. I can't remember who it's by, to be honest with you. During my uni degree, we had a unit called Pain, and it was based off that. But yeah, it's called Pain, and it's excellent. It really dives in deep about how the nervous system changes, especially as the person progresses to chronic pain, and how they perceive pain. Talks about how people who have lived in pain throughout their whole life and how they just consider it as their daily thing. Like you know how me and you are just talking like this on the podcast. People think of pain that way.
Yeah,
it's pretty crazy.
Yeah,
but it's fantastic. I highly recommend it.
Jordan.
Yeah, the book that I recommend, it might be the same one. We could be thinking about the same one, but this one's called Explain Pain. It's by Dr. Butler and Dr. Mosley, and it explains pain in layman's terms. It's got really good pictures to kind of talk you through everything, and it's probably one of the best books I've read about pain, and it's not only for the practitioner, it's also for the client. So I'd recommend Explain Pain highly.
Got it. Thank you, boys. And where can people find you, Radliff?
Instagram, mate, Radliff for Rehab.
Can we still get the merchandise, or are they all sold out?
Nah, a couple more teas. We've got got one right here, mate. I'll show you.
Oh, show them. They are fresh.
My housemate made these.
Bro, they're so slick. You want to shout him out? Who made them?
Oh, look at that. That's great.
Name's Jimmy Newman. He's my housemate. Absolutely.
Oh, Jimmy.
Yeah.
Jimmy. Does Jimmy Newman have a website or an Instagram that he does his graphic design on?
Yeah, I think it's just James Newman. If you go onto my page, he's tagged in the photo that we did for the shirt as well.
Love it, Jimmy. Great job. All right, boys. Unless you guys got any last anything you want to say, then thank you both so much for coming on, and I'll talk to you in a sec, Radliff.
Thanks, Alex. Thanks for having me on, mate. Appreciate it.
No problem. I'll see you guys later.
Catch you later.
Cheers.
Alright, guys. That is Webinar Wednesday 19 with a bit Allied Health Professional Edition. We have with my friend and colleague Jorden Radliff, and that's a great example of how me and Jordan integrate. Like, I have been referring my clients to Jordan for feels like years at this point, on and off, and often doing initial assessments with him as a compulsory thing, so I can screen my clients through him, through his lens. And it's something we definitely recommend you guys look at. Like, Jordan's based in Moorabbin, and Andrew's based in the Brunswick area. Also, Jordan's based in the Brunswick area too. Goes back and forth. Like, those are two guys that we can all like look to and like, hey, can I use you as my referral? Like, if you're listening to this and you're a coach or a health professional, you don't have an allied health professional in your corner, here's two great examples of them. And I can say it's definitely makes you think you don't have to do everything on your own, right? We don't have to be the expert in every single facet of human science. I mean, practically, that's going to take decades, right? So before you get to that point, we might as well humble ourselves and work with each other in more unison, in more synergy, right? We should always do that anyway, but especially now when we don't have as much, experience along all these topics. This is, you guys can go to orphiceducation.com and you can see our webinar Wednesday is every week. We've had a bunch of different guests on, everyone from the Brett Bees to the Carl Goodmans and the Lockie Wilmots to the Christian Woodfords. And every Wednesday we do these podcasts live. If you guys want to be notified when we do them, just follow us on social media. Post about it every Tuesday, or just put your name and email in the Orphic Education box on our website. All of these are on YouTube, Facebook, all podcast platforms, so you guys can listen to them anywhere. I'm Alexander Emanuel. If you want to find more about me, that's my name. Otherwise, I'll see you guys next week. Stay well, stay healthy, stay strong, and let us know if you need anything. And if you want to become a PT and a coach, and you're serious, and you're not looking for the quick fix, but you're looking for one of the most comprehensive courses out there, we might be a good fit for you. You let us know. Otherwise, I'll see you guys next week. Stay well.